I'm free. Oh, I'm free. Oh, you're welcome. You're welcome. You're welcome to Veritas Edu-Consult. This is a place where we talk holistic education. I'm glad to have you. I'm glad to have you here at Easy. I'm glad to have you here at Mayowa. Thank you for joining us. You're welcome. Okay, quickly, let's go to the business of today. But before then, let me reiterate what we talked about the last time we had this Insta Live session. We talked about holistic education, what makes education holistic, and our guest spoke to us about the cognitive aspect of education, the psychomotor. The cognitive has to do with the intellect, the psychomotor, and the affective. The affective has to do with the emotional aspect of education, and the psychomotor has to do with the hand skills aspect of education. Oreoluwa, you're welcome. Thank you for joining us today. Now, what is Veritas all about? Veritas is about bringing education to us, both formal and informal. Everybody knows education can either be formal or informal, but a lot of us just feel once education is mentioned, it has to happen within the four walls of a school. That is what we're trying to correct here, that education is not just for the four walls of the school. Education takes place everywhere. At home, at work, while you're cooking, while you're working, while you're playing, education takes place everywhere. And education has to be all round, holistic. It has to be holistic. It doesn't have to just be with you building your intellect alone. You have to build your emotions as well. You have to build your spiritual aspect of life as well. You have to build the physical aspect. You have to build the social aspect as well. Every aspect of life has to be built when it comes to education. So today we are talking about dental health. Dental health. Some people call it oral health. You're correct. Oral health, dental health. My guest is already in the house. My guest, you can request to join us now so that we can kickstart our discussion for today. Hello, doctor. You can request to join us now. Hello, doctor. Doctor, I sent you a request. Hello, doctor. Is doctor there? Okay, while we wait for doctor, I would like to read out his bio. Like I said, today we're talking about dental health. What is oral health? What is dental health? What does it mean? Then a lot of myths. Okay, doctor already is here. Okay, he's here now. Hello, doctor.
Yeah. Hello.
Okay, doctor, you're welcome. You're welcome.
Thank you very much. Thank you very much.
I know you're very busy. Thank you for creating time for us.
My pleasure.
Okay, so today we're talking about dental health. As we clearly, doctor.
Yeah, I can hear you. The line was breaking, but I can hear you now.
Okay, I can't see you clearly, but I think I can hear you.
Okay.
Okay, doctor. The last time I reached out to you, I told you about dental health. I have seen the need to talk about dental health because I have seen how a lot of us have ignored this aspect of life, aspect of our well-being. When it comes to our well-being, we have ignored it a lot. So we tend to look after some other aspects of our health, but ignore the dental part of it. So today, we want to talk about what oral health is, what makes oral health good or bad, what are the health conditions that can be linked with oral health. When I was doing my research, I discovered that a lot of health issues emanate from bad oral health, and I felt we need to talk about that today.
Yeah,
Okay, doctor, are you still there?
yeah, I'm here. I'm here with you.
Okay, all right. So, doctor, I know you are a dentist by profession, and I know you run an initiative. I know you're a public speaker. But today, we want to focus on the part of you being a doctor, a dentist. So you're going to look at us today as your patient that you're trying to advise. Okay, so doctor, what is oral health? What do you think oral health is?
Okay. First of all, I want to say hi to everybody present, and quickly, I'd like to just tell you what oral health is about. Unlike what a lot of people may know, when they hear the word dentist, even as a secondary school student, I think up to JSS3, I just felt a dentist. Is that doctor? Is a doctor of the teeth? But apparently, with time, I started discovering that it is much more than that. So, oral health is actually the aspect of health, the aspect of healthcare that deals with the well-being of the human from the gateway of the body. Actually, the gateway of the body is the mouth. So the oral health is that part that does talk about the health of the teeth, the tongue, the mouth, the how the oral cavity, that's the mouth itself, how it relates to giving you confidence, how it affects your smile. Some people, some person may feel like, okay, I don't have a dental, I don't have a toothache, per se, but still some of these persons cannot really smile properly. How good is your smile, for instance? So some of these things are part of your oral health. There are so many things that can link the general body to the mouth. So how well are you taking, how well your mouth is can also tell us how well your body is doing. Do you understand? So it's not all about just taking care of the skin, but it's also what is part of it is how well your mouth is, how healthy you look, it feels, it looks in your mouth.
Wow, wow, wow. So you said some people don't like to smile. Does it mean if your teeth is not white, does it mean you have problem with your teeth?
Well, that's a long story entirely. But the thing is, if you have teeth that, the teeth, there's a misnomer, there's a misconception that the teeth are supposed to be white. The teeth are actually not 100% white. They are not even supposed to be white in a sense, because but they are supposed to have a kind of off-white color. And even if the teeth are becoming so white, we regard it as a pathology, a problem. But some people have the other spectrum is that the teeth is now brownish, has a lot of things stuck to them, and so the person is not confident when they talk, is not confident when they smile. So that's like a problem. That's like it's a problem that is similar to like a sickness. When people say sickness, that can give you some kind of psychosocial problem.
Doctor, you're going deeper with that psychosocial you mentioned now. I may have to begin to go deeper with with the
And
psychosocial you just mentioned again. But that's not our topic for today. So I'm not going to go that route. I'm not going
okay.
to go that route. Okay. I would like to talk about some of the things I saw in your bio because
Okay.
I may need to dive a bit deeper into who you are. Dr. Mayowa Ajebeku is a dentist, a dynamic public speaker, and a career coach with special interest in leadership development. He is the founder of Take Charge Initiative. He attended University of Benin, where he was awarded the degree of Bachelor of Dental Surgery. During his university days, he served as the president of the University of Benin Dental Student Association. Currently, Dr. Mayowa works as a dentist at the University of Benin Teaching Hospital in the Department of Oral and Maxillofacial Surgery. Doctor, how do you hail the president in Benin, please? Can you teach me?
How do you do it?
How do you hail yourselves now?
Stuff like that.
Okay.
Just,
Okay. All right. All right. Okay, doctor, you mentioned that how your oral health is shows us how healthy you are. So, what
yes.
makes your oral health good? What are the things that shows that your dental health is good, and what are the things that shows that your dental health is bad? What are the things to look out for?
All right. Very good. There's a part. Just permit me to go a little bit. Not this is not actually deep. Just permit me to go a little bit deep into it. Actually, there's something about. I'll be talking from the general view to bringing us to what should be. Now, how do people regard? I'm going to ask that question in another way. How do people regard somebody that has a good oral health, and how do they regard somebody else that doesn't have? So people think you have a very good oral health when once they look at your teeth appears to be white, and your mouth is not smelling, of course. So, but the part of the teeth that we are seeing is actually like is less than 30% of what is in the mouth. Actually, so when they say or somebody's oral health is good, it goes beyond seeing the facial part of the teeth. They call it the facial part. That means the part that we are seeing. You can't see the inside of my teeth. You can't see the molars at the back of in my mouth. And as I'm doing this online session, you don't even know if I got a mouth odor, for instance. So how do you know somebody's oral health is good? It's when the person, somebody has taken time to take care of the mouth, give the mouth attention. Now, number one, we are not having odorous stuff coming from the mouth when you're talking. You can be confident enough to talk. Then number two, we are not seeing unsightly stuffs on your teeth when you talk. Then number three, when you talk, you are way. In that way, we can see okay, you are putting a high on your oral health at that point. So it's all about confidence, confidence that emanates from cleanliness of the oral cavity.
Okay, thank you, doctor. Thank you so much. Somebody is asking you here, saying, why is Dr. Mayor gentle now? Because they know you to be their president, so they feel you're too gentle today. Today, Dr. Mayor is not a president today. He's a doctor today, so he has to be gentle. So he doesn't teach us the wrong thing about our teeth. Dr. Mayor is a doctor today, not a president, not the youth president in school. Okay, so what are the health issues you feel can emanate from bad oral health? What are the health issues? Because when I was researching, I saw that cardiovascular diseases can emanate from oral health, and I felt, what is the correlation between your teeth and cardiovascular diseases? How does bad oral health bring about cardiovascular diseases?
All right. Before answering that question, I would like to quickly say that so many things are online, and you need to be able to filter information. And thank God for this kind of session where you have to do a fact check on some of these things. But
Okay, sir.
of a truth, cardiovascular diseases and several other diseases can arise from poor oral hygiene. Let's take it that way. Now, there's something that is called infective endocarditis. That is the most probable disease that can emanate from poor oral health. You see, there's something that is called dental caries. That's when people begin to have toothache, begin to have all those things. The 90% of the times it is from dental caries. Now that's like an infection ongoing in the tooth. Now that there's a particular organism that starts that infective process. Usually, the name of the organism is Streptococcus mutans. I'm not going deep. Streptococcus mutans, when it starts the disease, other bacteria continues it. Now, this thing can have it gets a point where the tooth is not, people think the tooth is actually closed underneath. No, there are blood vessels that enter inside the tooth to feed the tooth itself actually. So the bacteria can find their way into those blood vessels. And all blood vessels carry blood, and the blood returns to the heart. So when the blood gets to the heart, and imagine this bacteria being in that blood that gets to the heart, and the bacteria just colonizes the heart, and it begins to give you what is called infective endocarditis. That means the inner layer of your heart is now infected. So people have several issues from it. People die. People have this is where they have to go and do artificial heart valves for them. Do you understand? So that means the heart can no longer really hold blood itself to pump and stuff like that. So they have to do artificial valves because of that. Just from a simple dental issue that could have been prevented by good oral hygiene. So very correctly, cardiovascular diseases can arise from poor oral hygiene.
Thank you so much, sir. Thank you. Somebody is saying what is cardiovascular disease. I'm sure from that explanation, you already got the definition of what cardiovascular diseases could mean. Then somebody said, I think I would need a dictionary. Doctor, I think people need dictionaries for for all those terminologies you're using, although they are medical terminologies, and I'm sure doctor is breaking it down for us little by little. Okay, there are other health issues that I researched and I saw. I saw that it causes dementia, respiratory infections, diabetes, pregnancy complications, infertility, erectile dysfunction. Those are the things I saw. Cancer, kidney diseases, arthritis, and so on. How true is all this?
Okay, very good. I wouldn't like to really talk about whether they cause some or whether they don't, because indirectly all these things are intertwined somehow that I can explain all of them. But I would rather talk about things that can directly come from poor oral hygiene. Now, for instance, someone when you mentioned arthritis and stuff, other things. You see, the thing is, there are some drugs you take for the pain that later give you other issues. You take a drug for dental pain. You take a drug, they advise you to take this one for this, take this one for this, just to the pharmacy, and they prescribe those drugs for you. Some of those drugs are the reason why you later develop some other complications. So instead of tackling the real issue, you went ahead and want to alleviate it, which is the main problem to you at that point, and they begin to cause other issue. Yeah, about kidney diseases. Some of these bacterial organisms, like the way I explained how it causes cardiovascular disease, that means bacteria from the tooth entering into the bloodstream to go and colonize the heart, giving it infection and stuff, causing infection there. The same way, the same blood can go give you a big health issue. So Imagine Streptococcus mutans or lactobacilli, some of those organisms go into the kidneys and just cause disruption. And they, being vital, all these things are just, they're just things that they will cause complications and stuff. And there's some other drugs that they give you for dental pain, and they will cause arthritis in the long run. There are even some that they give you that they will maybe cause peptic ulcer disease, which you all know as ulcer, stomach ulcer. So, that's what some of them can also still result in. So, apart from when you mention dementia, you talk about dementia, you see sometimes, sometimes dental pain can really, when it comes from the teeth, can really be so bad that they affect, I don't know, as long as those that have felt dental pain before, we are saying that sometimes when they feel the pain, they have serious headaches. And when they have serious headaches, there's a kind of headache that the way it radiates, and the pressure that you feel in your head, it can really go ahead and, just give you maybe feverish feeling and so something little will just happen and you think, okay, that's all, it's all wrapped up. But at that period, you begin to feel so much, you can just find out that you just started forgetting one or two things or something else. A lot of things can just happen to your mental state. Even people usually compare, people that have had serious dental problems, they usually compare it with childbirth, the pain of childbearing. So, sometimes when you have that kind of pain, you can easily be able to tell them. So this thing can cause, a temporary memory loss. It can be that bad.
Wow. So, doctor, now that we know that there are lots of health issues linked with poor oral hygiene, what are the practical ways we can begin to put to practice? What are the ways we can begin to put our oral health through in the right way? How do we practice good oral hygiene? How do we improve our oral health? What are the things we need to do? What are the practical things that we can do to improve our oral health?
Okay, very good. I would like to divide this particular part into two. The do's and the don'ts. What you should do and what you should not do. Now, number one thing that you should do is to do a simple brushing. It can be very difficult sometimes when you advise people to do the simplest of things and you find out that those are the things that we have problems with. People have talked about twice daily, 1,001 times, but you find it very difficult for people. I was talking to somebody recently, and the person told me that that's a waste of toothpaste. They can't brush. And let me shock you a bit. Do you know it's actually more important to the dentist? For a dentist, we see it as more important to brush in the night than to brush in the morning.
Wow.
Because like an old proverb in whether China says, it says you brush your teeth in the morning to keep your friends, and you brush your teeth in the night to keep your teeth.
I think you need to say that again. You brush your teeth in the morning, you keep your friends. You brush your teeth in the night, you keep your teeth.
Yeah. So if you look at that proverb very well, if you brush your teeth in the night to keep your teeth, and you brush your teeth in the day to keep your friends. So if you don't keep your teeth properly, by the morning, your teeth are now bad. How are you going to keep your friends when you don't have teeth any longer? It's very funny. So I'm going to tell you that it is very, very important to brush at night. And some of us may have watched all these American films, foreign movies. You see somebody will just say breakfast in bed, and most time when those breakfast in bed happen, the lady is just waking up. Most times usually for the lady. So the lady is just waking up from bed, and the guy just brings toasted bread, fine delicacies, and a drink. Everything is just nice. So the person eats without brushing at that point, and we don't query it. We feel, those people are white, they are very clean and stuff. The reason is they brush in the night. Most times they brush in the night before they go to bed, and that's the last thing. And after brushing in the night, you don't eat again. It's not about brushing before you eat in the night. So it is actually possible that when you brush in the night, in the morning you can eat. You will eat. Just go ahead and eat. All you need to do, if you feel somewhere in your mouth, just rinse, gargle with water. and then you can go ahead and eat. Then after eating in the morning, that is when you should now what? Brush in the morning. Because after breakfast, the time lag, that's the time after breakfast till when you brush your teeth next, or the food that is in your mouth, bacteria might be acting on it. So imagine you brush in the night, eat in the morning, then brush your teeth afterwards. You can easily stay clean till the next meal, and before you know, in the night you brush again. So that's the most effective way of taking care of our oral health. Now that's number one. Then number two of things that you should do is flossing. Now many people, it's not every one of us. People like me that have closely opposed teeth. You can say it. My teeth they don't have gaps. They don't have big large gaps. Now, how do you clean those areas? The thing is, you clean those areas using floss, dental floss. A lot of us use toothpick. I still come to say today that on behalf of International Association of Dentists all over the world, it is wrong to use toothpicks. Yes,
I think you need to say that again. On behalf of the International Dental.
Yes, Federation of Dentists in the world. I'm telling you that it is wrong to use toothpick. We advocate the use of. I know it's going to spoil a lot of people's business if they are going to follow it, but we advocate the use of dental floss. Yeah, dental floss. Dental floss are like, I don't know, some of us have seen it in all those movies. You watch foreign movies, and if you don't watch foreign movies, you see dental floss. You can just Google it. It's like a strip or a rope, a strip. I wish I had one. Yeah, I don't have one. It's just like a strip, a rope kind of stuff, and in between your teeth, you clean interdentally. That's in between the teeth. You can easily do that. You can easily do that. If you do that once in a day, you'll be all right. By so doing, you'll be able to take care of the part of your teeth that toothbrush cannot really brush. Now, the number three of the do is how to brush. A lot of people don't know how to brush. It's ridiculous. Actually, I thought I knew how to brush until I got into dental school years ago. Yeah, I think I can make bold to say more than 70% of Nigerians don't know how to brush their teeth. Yeah, that is why we come down with dental issues a lot of times. Now, let me show you. I got a toothbrush around for the purpose of this. Now, you can see this toothbrush. Now, a lot of people, I'll start from saying talking about the quantity of the toothpaste. A lot of people think, if you want to brush very well, you put it, make the toothpaste, just fill the toothbrush. No, that's not right. In fact, that is how to waste toothpaste. Yeah, that is how to waste toothpaste. Wasting toothpaste is not brushing at night. How to waste toothpaste is to pack plenty toothpaste on top of your toothbrush. That's wastage. Now, all you need for toothpaste is just like pea size. Pea. Okay, let me put it as peanuts. Peanuts. That normal granola size. That's the toothbrush most times. If you think, okay, maybe you're not comfortable, you can just put a little. It's not supposed to be too large. You can see this toothbrush. See that part that is blue? That's where your toothpaste is supposed to stay. It's not supposed to be too much, like all over. Now, when the toothpaste is already on the toothbrush, what you do first, you don't need to put the toothbrush in water. I know a lot of people do that. You just first dip it inside water, then bring it out before you can start brushing. It's not so right because you are adding to the fluid in your mouth. But I understand why many of us do that sometimes, because where we keep our brushes, we don't trust them to be safe from rodents and ants and then cockroaches. But if you will be nice to yourself, you should keep your toothbrush somewhere that those insects and animals can
rodents wouldn't get to.
But once your toothpaste is on your toothbrush, what you need to do first is to open wide and smear the toothpaste all over your teeth. You just put it in, smear it all over quickly, as fast as you can. The saliva in your mouth is enough to do the washing. Imagine you want to wash plate or you want to scrub something, and you're adding plenty water already to start. It's going to dilute the soap too much. So that's why you don't put water in your mouth to start. Just do that first. Once you smear it all over, then you now begin from the side. You start brushing from the side up. Start from up and brush down. Look at this toothbrush like this. you're supposed to do this, as if you are as if you are making a C shape on your tooth, on your teeth. C is not up down. So when I tell you that you don't know how to brush, a lot of people don't know how to brush. You should understand why I'm saying so now. It is not up and down. It is not front and sideways. It is C, and that C that you are drawing, firstly for the upper teeth, outside. Go C, 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 C. Once you get to this place, turn your hand, you have C, C. Then when you go down and do the same C from down to up. You see, why we're saying down to up? You are not taking up to down because you are not. If you go up to down, you'll be taking the germs and all the food debris and everything in your mouth into your gums, and some will enter your gums definitely. But if you go from down to up, it's going to take it from your gums out into your mouth, into your oral cavity. So you do that same thing down, then you go inside to the part that is close to your tongue. You do the same thing down, up, down, up, down, up. Then when you get to the upper teeth, you do up, down in C shape. Once you do that, then you can now do the part we call the occlusal surface. The occlusal surface is the part that actually grinds the food. So you go there deeply and then do this. You come to the other side, do that same thing. Come to turn it up, do the same thing. Then upper side to brush the inside. That's the part of your lower front teeth that your tongue touches. You just go and brush it out this way. Out that way, and that's by so once you are done with that, you can just put water in your mouth and rinse. Now that's another part where a lot of us don't know how to brush. You don't take in so much water to rinse. Once you do that, you are defeating the purpose of fluoride in your toothpaste. Once you take plenty water, you really hate the feel of the toothpaste in your mouth. So you are beginning to throw a lot of them out all the time. You rinse like some people rinse up to like 4 or 5 times. Which is wrong. It is normal for you to feel toothpaste in your mouth. In fact, some people advocate that you don't rinse your mouth at all. But as far as Nigerian Dental Association is concerned, the standard in Nigeria is that we recommend that you should rinse, but rinse once. Rinsing your mouth once, just put water in your mouth, rinse as much as possible, and then out. The only time you can rinse twice is when you still feel that some of these food particles are still in your mouth. Then just rinse for the second time. So you are supposed to really feel small part of that toothpaste still in your mouth somehow, so that the fluoride on those toothpaste can stay on your teeth. Do you understand? They can stay on your teeth. So that's how to brush. So
that means, doctor, once you rinse too much, you're actually forfeiting the effect of the fluoride in your mouth, the fluoride in the toothpaste.
Much the fluoride is gone, everything is gone. So you are left with it's just like washing and not not applying the fluoride on the teeth.
A lot of people are beginning to confess now. A lot of people are confessing now that truly I don't know how to brush. And I must confess as well. I think I'm guilty as well. I'm learning. Thank you, doctor. I'm learning. Continue, sir.
All right. So now to the don'ts. Now let me say one last thing about the do's. Another thing that you should do when if you want to take care of your oral health very well is to avoid herbal toothpaste as much as you can.
Wow.
It's not necessary. Yes, it's not always necessary. The thing is, some of these herbal products actually, they might be good. They may have some things to protect your teeth, quite all right. But I think we should just let it be prescribed. Some people have some chronic dental issues and be like, okay, these things are not solving it. So they want like, can you try this particular herbal toothpaste? But it's not about using herbal toothpaste and you feel like, some people feel if they've not taken something bitter, that they are not, the thing is not working. It's a lie. This time around, you shouldn't try to, always want to take herbal toothpaste. It's not, there are some of them that, why we discourage it in Nigeria is that a particular percentage of the country, in fact, I think all over the world, about 30% of persons react to a particular content in herbal toothpaste. Now, if that content of herbal toothpaste, if you react to it and you don't know, by the time you just brush with herbal toothpaste, you might begin to have burning mouth sensation throughout for the next 1 week because you are brushing with. And some people even have, they don't know. I've had patients in the hospital that they will come to the hospital, they just don't know what's happening. Their mouth is burning. Some people have gum recession. They have a lot of things, but they don't know why all those things are happening. Wow. Then we continue to ask. So when we ask in the hospital, like, okay, so what toothpaste? We have asked all the questions. We don't really know what's going on. Like, what toothpaste do you know? Then somebody tells me, oh, this particular about toothpaste. I'm like, okay. Now, the person has paid for consultation. The person will pay, for probably scaling and polishing that we'll have done. And then only to discover that it is the toothpaste that is wrong. Then we'll tell the person, okay, stop that. You can change your toothpaste. And after 1 or 2 weeks, the person gets better. So you should try and avoid herbal toothpaste as much as you can until probably prescribed or a professional just asks you should try another toothpaste. Some people react to some toothpaste actually. And then, the toothpaste that is recommended are toothpaste with fluoride. Once they contain fluoride, they are good for you. People make the mistake of thinking, since they want to take, they feel medicated toothpaste is the next thing to start taking. If you don't have a reason for using medicated toothpaste, you should not. Okay, I think I've started the don'ts. If you don't have a reason for taking using medicated toothpaste, you should not. For instance, all those Sensodyne, all those so many of them, I can't remember a lot of their names now, but they are really, really medicated together, and they are usually very expensive. And you don't need them if you don't have specific problems that they must have written on the pack. Sensodyne is for treatment of sensitivity. You're always getting your teeth always sensitive. Then you can start applying Sensodyne. But if not, you don't need it. You don't need it. So you should just use simple fluoride, the one that you like. You like the taste, you like the fact that it's not too hot, or you like the fact that it's very hot, you can start using those ones. So that's number one, don't. Then number two, the things that you should not do is that you should try and not use your teeth on foreign things unnecessarily. I'm saying that in good English now, but I'm going to put it in our chapter. No, use your teeth open coke. Don't try it. It doesn't make it's not right. It's not good. You shouldn't do that. Some people think the teeth are they're like stones, you can do anything. The strongest tissue in the body from head to toe is the enamel. That's the covering of the teeth, of the tooth. That's the covering, that's the outer, that whitish part. It's the strongest part. But the fact that it is very strong does not mean that it is standing in the socket in the mouth, and there are some fibers holding it to those. By the time you start using your teeth to open coke, and you begin to weaken those fibers. Before you know, your teeth can start shaking. Even if they don't shake, they can have a frank fracture all of a sudden. If they don't fracture, they can have your teeth can have this. You can start having pains around. You don't know. You might have forgotten that you opened coke with your teeth. But you just start having those pains, and they all just start happening, and you don't know why. Some of those things are things that can cause. So don't use your teeth on very hard. It's not just coke. Some people use their teeth to remove nails from wood. Some people use their teeth to they want to try and scratch something off something. They want to just use their teeth. They are tempted. You should take care of your teeth. They're parts of your body that need to be taken care of. So that's another don't. Then another don't is that you should try as much as possible to not open your. Some people feel they take some kind of drinks, some kind of things to take care of their teeth when they have teeth pain or something. They begin to buy. There's one popular one, Anacin. If you know about Anacin, I think you should just type now. Anacin is actually an analgesic, that they apply to the tooth in the mouth, which is wrong. It shouldn't be. Because what it does is that it just kills the life substance of the tooth without doing much, just relieving pain temporarily. So there are some things that you shouldn't do. All those about concussions to put, even all those data about powders. Most of them are very, 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 very. In fact, not most of them. All are not to be used. You know why? The thing is, some of them contain fluoride and stuff, but most of them contain stuff that will do more harm than good if they are susceptible to this thing. You don't just know where you started. You don't just know where you started. You just be wondering how did this thing started? How did this all start? But you won't know that it's just the herbal powder you are using. It doesn't make sense. That somebody, if you want to white teeth, it's not about using herbal powder. There are several things to do. You can go to dentist. They can do teeth whitening stuff for you. You can even there's this charcoal stuff. People think it's a myth, but actually, as funny as it sounds, charcoal mixed with a few other ingredients can be used in improving the appearance of the teeth. Grinded, you can call it activated grinded charcoal, can be used to whiten the teeth, to improve the shade of the teeth to an extent. So that is very, very valuable. So those are a few of the don'ts that we should, of the things that we should not do.
Dr. Mayo, thank you so much. I really need to clap you. I need to clap you. Thank you so much. In fact, you've done more than justice to this topic. But before we close, I still want you to, because while you were talking, you mentioned scaling and polishing. Is scaling and polishing for those that have tooth issues, or scaling and polishing is important for all of us? And if it is, how often should we go for scaling and polishing?
Okay. First of all, scaling and polishing is not teeth whitening. Scaling and polishing is removal of things that are stuck to your teeth. There is mechanical removal of those things. So scaling and polishing should be done by everybody twice a year. That's every 6 months, or at least once in a year. The reason is, there are some things that toothbrush cannot take out. They cannot. No matter how much you try, they won't be able to take them out. I've seen people that use nail to remove those hard substances from their teeth. Some of us, we smile a lot, but those things will not show. But ask people to shine their teeth openly, or just open your mouth wide and see the inside and see that those things are really stuck there. They're not really good for your health. So at least once in a year, you should go for scaling and polishing procedure. And that is what it is. That's the first step. And
wow. So at least once, okay.
Not doing and polishing for you without checking it generally. So you have also used the opportunity to do a simple dental checkup. So if you have a problem, it will be identified and be well treated before it escalates into something that will make you lose the tooth.
Wow, thank you so much, Dr. Mayo. So once in a year at least, I must go for scaling and polishing. I'm sure some of us in this Insta Live session now have not done scaling and polishing. Some of us have never done it. That is why this is coming up, so that we know what to do. This is education. This is part of education. This is what we do. It is not just about building your intellect alone. There are a lot of things we need to understand that we do not know, and that is why we're bringing the likes of Dr. Mayo and other practitioners in the education field to educate us on all those things. Now, Dr. Mayo, I want us to link this to the education sector. Those days in school, I know they check our teeth. God help you, you didn't brush before coming to school, and you're on the assembly ground. And there is this inspection they do on the assembly ground, and they tell you, open your teeth. And you open that teeth, and it's showing some kind of dirt, this kind of whitish dirt on your teeth if you didn't brush. You see that people start using their clothes or handkerchief to quickly clean their teeth. That is how conscious we were of our teeth then. Once you're going to school and you know that inspection will be done, if it means just brushing it anyhow, you brush it before you leave home. So how do we link this? How do we link this to the education sector? How do we begin to, because I don't think anything like that inspection is going on now in most of the schools. I think some of the schools still do that, but a lot of schools abandon that already. Teeth are not being checked, nails are not being checked. So how do we begin to create this awareness in our schools?
Okay. Actually, I would say oral health, they actually, there's a way you if you're not taking care of your oral health, there's a way it shows that it affects your confidence level. So somehow, some way, apart from the kids, that's the kiddies classes like primary school, people get to check their oral health at least to some point before somebody has to tell them to do that. So in the education sector, I feel if we begin to re-emphasize this thing in schools, make people understand, people have things that are easily solvable. Some people feel their mouths is smelling. Some children think their mouths is smelling. Some children can't really smile well because their teeth are scattered. There's something they call shamga teeth. My prof will always say is a lady shamga. When the teeth. Some teachers will just see those things and they will not be able to call the parents of the child that, see, you can go and see the dentist for this, and in 6 months.
That's because they don't know, doctor. That's because they don't know.
So I think teachers. That's
because most teachers don't know
the simple routine of how to. It's not just about telling the child you need to pass. You need to. You see your life. You see your life. There's a way they used to talk. How they talk to students those days. About that, there are some things that the child is not confident. They may not be confident about. The child may not be confident of how she looks. May not be confident of how and even a lot of us as grown-ups, when we're talking to somebody, the person is just shifting back a little bit. We begin to think that is my mouth smelling? Something like that. And the best way to approach some of these things is to let teachers know on time. Like, see, you need to start looking out for these kids. If somebody is having dirty, we're always saying that the child has, this yellowish stuff attached to the teeth, you can just call the parent, tell them have a simple dental checkup. And sometimes I think it's advisable in some parts of the world, like in UK, before children go to resume school, every time they are about to start a school session, they all bring to the school their receipts. That's that they are like a certification from medicals and dentals, medical checkups and their dental checkups. So they have to make sure that they are well and fine. They are doing fine. So it's not just about trying to bully people or following up people strongly. Like you said, some kids will just be there and just use their clothes to clean the teeth when they know that it's very do that. But nobody when you see that, okay, this is how things work, this is how things work. You want to be more confident. You just have to take care of it. And I think teachers should just really be intimated on how to do these things and relate the matters to the parents.
Thank you, doctor. Thank you so much. I'm actually enjoying this session, and I'm sure our audience too enjoy this session. I would have loved to continue with you, but our time is fast spent. So we need to wrap up now. We need to round off now. Like you said, what we do not know, we cannot teach. What we don't have, we cannot give. So as a teacher, as a parent, as an educator, as a proprietor, as an individual, you need to understand these things. When you know it, that is when you can help any other person. If you don't know it, you can't help any other person. Just like Zika said here that I think some people know, but they hide under the influence of no funds. Just like one of my coaches will say, if you know better, you will do better. I do not think they know. When you know the consequences, you do what you're supposed to do. So when they know better, they do better. And that is why we are here at Veritas Edu-Consult, to educate you, to bring in practitioners, to bring in consultants, to bring in experts in several fields, to educate us, to make us understand the things we do not see. A lot of things that we have been taught wrongly, we want professionals to come and tell us how it should be. A lot of things we have been told that are not true, we want professionals to come and tell us what it should be, how it should be done, what the right things are. That is what Veritas Edu-Consult is about. That is why I'm going to say thank you so much, Dr. Mayor. Thank you so much. Thank you. We are grateful for educating us today. We learned a lot from you. We learned a lot from you. And please, everything you learn here, please make sure you put them to use. It's not enough to learn if you do not put them to use. You should learn and at the same time put them to use. And as you put them to use, educate others on what you have learned. Next month, we're going to be bringing another practitioner in here. He's a life coach, and he's going to be talking to us about the importance of emotional intelligence in the education sector. The importance of emotional intelligence. Make sure you follow this page so that you do not miss out on this information. Once a month, we bring in practitioners here. Thank you so much, Dr. Mayer, for joining us today. And thank you, everyone, for being part of this Insta Live session of dental health. God bless you. And please make sure you put everything you learn to use. Dr. Mayer, thank you. God bless you. All right. Bye-bye for now.
All right.
Bye for now, and see you next month.
Thank you.